Welcome to the Faculty of Dentistry. Let me kickstart. I'm Professor Mike Leung, and today my role. I have several hats in the faculty. I'm the admission tutor, so I'm responsible for setting admission goals and responsible for the whole admission exercise. I'm also a associate dean of external relations. Professionally, I'm a surgeon. I'm an oral and maxillofacial surgeon. So I do surgery in the head and neck. I focus in doing jaw deformities like long jaws, short jaws, asymmetries, also doing TMJs and pathology. So that's my professional side. So I know you all may be interested to study dentistry, or your kids are interested to study dentistry, or you want your kids to study dentistry. And today we are very honored to have two students here. Richard Seal from BDS 5 and Tiffany Lui from BDS 4. Any of her fans or her brother's fans here? I'm not surprised, okay? And we also have our dean here, Professor Jin.
Welcome to our home. It is full house, so I don't have a seat.
Okay, before we start, Professor Jin wants to have a little ice-breaking game. Who can guess how many dentists are there in the world? I will invite five people to answer. If the closest, we will have a little gift. And you can present this in your interview. As I answered it right. Add one more, just kidding. How many dentists in the whole world? Yep. 1.6 million or billion? Million, okay, 1.6, okay, any other? We invite five, yes. 1.7 billion.
Three more.
Any more? Three more. Yep. 1.5. What? Million. 2.1 million. Last one. Yep. Sorry. 1.6. Okay, the answer is
1.15. So I invite the one who gets 1.5. Okay? Come again. I offer you the faculty pin. It's a valuable piece of gift. Look here, okay?
Okay, that's the end of the admission talk. Okay. Testing. Okay, so we are not doing in the normal admission talk way that I give you all the information. I'll give you the essential ones, but I want to involve our students here to share with you a life of our students and how do they get in, what are the obstacles, what are the sweet and sour of studying dentistry. But I first started, we are very proud that we are the world #2 dental school in the whole world. So if you want to study the top program in Hong Kong, irrespective of what it is, this is the one, because we have the highest ranking among all programs in the world, in Hong Kong, not in the world. We are current #2. We hope to get #1 next time. We have been world #1 for 3 times some years ago, but these things comes ups and down. And we are very lucky to have very good support from not just the teachers, but also from the hospital. You are in the Principal Dental Hospital, and that is the place most of the actions are here. Our students will spend most of the time learning how to treat patients, how to do their lab work, but we are supported by the hospital, not just of that, but we are supported by the dental surgery assistant, aka nurses, the technicians, all the facilities here, and these are provided by Health Bureau, and they are devoted to support our dentist training. And I have to say this is probably the best in the world, because we are very, very lucky to have all these supports. Like dental surgery assistants in most dental schools, they may have 1/3 or even less of the support that we are enjoying. Having said that, our curriculum, of course, is 6 years. I'm not going to answer all the questions about like what's admission score, how high to get in. but I'll tell you the details. But before we start, maybe we ask Richard, you introduce yourself.
Hi, my name is Richard. I'm currently studying year 5 dentistry. I graduated in 2021 from Renaissance College, Hong Kong. I don't know if anyone is from that school right now. Okay, I see a few hands up. But yeah.
So noted.
Oh, sorry. Did anyone hear me there? Okay.
Pretty.
Hello, I'm Tiffany Ler and I'm studying in BDS year 4 right now. Nothing much to explain.
Okay, so we have one from the non-JUPAS and one from the JUPAS system. So we'll talk about the hard facts later. But first of all, maybe I ask Tiffany, why do you pick dentistry? Sounds like an interview, by the way.
So actually, I think I prefer medical aspect starting from like Form 3. And then the reason why I choose dentistry is that I want something like work-life balance. And also, I think in dentistry, the working environment is maybe more comfortable than other industries. So I choose dentistry, yeah.
And Richard?
So there are quite a lot of factors why I chose dentistry. First, through the attachment I had during high school, I was able to see how dentists are they emphasize a lot on attention to details. And I love the aspect where they get to communicate with a lot of patients. They show empathy. And I think that very suits my personality. And I think that's what I wanted to carry into my future practice.
Okay, by the way, these two students are not just very good in result. Oh, by the way, Richard is IB's top scorer. And he is also the current team captain of the Hong Kong youth basketball team. And the Hong Kong youth basketball team is a champion of the inter-university. By the way, having said that, we love to have sports scholars or sportsmen. You don't have to be sports scholars, but if you like sports, there's something we are looking for. I think sportsmen like Richard, he's not a sports scholar, he's just a top scorer. But we love sportsmen because what we believe is that the sportsmen or people who like sports have the character that we are looking for as a dentist. They have very good, not just a hand-eye coordination. They cooperate with others. They communicate with others. They don't lose easily. They are very determined. They will strive for their best, and they would just be attentive to details because that's what's needed in any sports. So that's what we are really looking for. But if you are a sports scholar, we recommend you to apply to us because we give a very generous discount to come in. Seriously, and as long as you are qualified to be a sports scholar, we will give you a discount. And as long as you meet the conditional offer and pass our interview, you will be admitted to us. So think about it. So like taking basketball here as an example, of course, this is the big brother, the team captain. But out of the 5 outfield players in the basketball team, 3 are from dentistry. And they got the champion. And the other 2 are sports scholars. And this is just a top scorer. Not in, are you the top scorer in the team?
No.
No. Okay. And Tiffany, of course, she's not just a normal dentist student. She's also going to 出道. What's your plan?
I'm going to 出道 in dentistry.
Okay. Okay, may Tiffany share with us, you're now a dentist student. You're the 4th year. How do you find the program?
I think, actually, I have been here in my year 1 career as well, but I think there is a large difference between my experience in year 1 and 4. Now I'm in the clinical part of the dental life, and so I think the life has been much more stressful than before because we're treating real patient instead of just having lecture. But I think it's challenging but interesting as well.
Can you share with the audience, how do we train you to treat patients?
At first, like in year 1 and 2, we have simulation laboratory. I think maybe you guys have gone through the tour today. And then we train like the skills and use of instrument, use of handpiece, and then we'll move into the clinic and practice those we have learned in real patients. And we have more and more specialty. And at first, maybe we have direct restoration, like composite restoration now. I'm going through endodontics and also prosthetic things. So I think it becomes more challenging and interesting. Yeah.
So all these terms are jargon, I understand, but like a doagan, a root canal treatment, making false teeth, dentures, bridges, even dental implants or third molar surgery, these will be taught in the curriculum. So of course, we don't let them just do on any patients. They have to learn in the simulation lab first. They have to know the theory, and then they have to practice on a mannequin. And some of these procedures they will practice among their peers, like we inject each other, giving local anesthesia. And there are many haunted stories, by the way. And then they will be having their own patients. And having said that, they have to give an oath in their third year, the beginning of third year, to promise they are delivering their best to treat their patients, because this is a big responsibility. Any one of you are scared to seeing dentists, by the way? No? Oh, okay. So you know how stressful it is when you're lying on a dental chair, and you give so much trust to your dentist to treat you. So we want our students to understand this is not something easy. This is not something light. They have to take full responsibility. That's why from third years onwards, they have a pledging ceremony, and we invite their parents and family member. Sadly, Eden was not available. We have been checking out. But we're inviting all the parents, and the parents feel so proud about it because they see their kids growing to be a professional. And through this, they will be doing their best to give to the patients. So Richard, as a Dai Si Heng, big brother, what do you think about our book?
I think our program is very good. It's given me a lot of opportunities to learn a lot of theories before I go into clinical practice. So if I remember correctly, from year 1 to year 2, it's mainly theory. And we did have a block where we had to study with medical students. So it's kind of like an in-depth of the entire body before we then slowly move up to the head and neck. And during that time, I didn't really feel like a dental student. But moving towards end of year 1, we were then introduced to simulation lab, like Tiffany mentioned. And then up until year 3 is when you get your first patient. That's when the real deal comes. And I think PUDH has helped me prepare very well. Very enjoying the curriculum right now.
What's your sweetest experience as a dentist student? We're not talking about the romantic part, by the way.
I think one of the most rewarding moment of my BDS career was when one of my patients actually gave me some snacks to one of clinic sessions, and she wanted to thank me for a treatment that I provided her. And I think that was very. Wait, am I allowed to receive?
Yes, secret. As sweet is fine.
But I thought that was very rewarding because I did put in a lot of my effort into helping this patient, and to feel that she was helped, I thought that was very rewarding. And it was actually one of the changing moments in my life where I was like, okay, like I am in the position to help alleviate my patient's pain, but I do want to dedicate my craft to this.
Tiffany, how about yours?
I don't have any romantic story to share.
We'll be on the news tomorrow.
Maybe for me, I have recently a patient that come here because of his fractured tooth of the anterior tooth. And then he was quite reluctant to smile because of the fractured tooth. But after I have done the restoration, I think he's very satisfied. And that is the moment that I think I really did something good on the patient, and I feel proud of myself.
Okay, so as you can see that the satisfaction as a dental student or even as a dentist is coming from the patients, and that is something we are quite proud of because we let our students to have the experience from the third year onwards. So they will be having the experience from third year onwards. That means 4 years of clinical training, third year, fourth, fifth, and sixth, and that's the longest in the world. We take for example, if you study in China, any stomatology they call it, not dentistry, they call it stomatology program, maybe 1 year of clinical training. In the States, they are DDS, Doctor of Dental Surgery, because you need a first degree. It's usually 2 years of clinical exposure. In UK, maybe 3 years. For Hong Kong, it is 4 years. So we have the longest of clinical training, and that is important because what I believe is it takes time for someone to mature, to treat the patients. It's not just a treatment, but a holistic care of the patients, and that needs time to develop. And it's not just about the skill of doing a procedure, but also how to communicate, how to understand, how to be empathetic. All these are part of these interactions. And they all have their own patients. As you can see that they have strong bonding with the patients. So they will have a own family of patients, and they call them, hey, Mr. Chan, are you free to come next week? I want to restore your tooth, or I want to do a root canal for you. And they build up this rapport from the patients and give them also satisfaction because they are really looking after them. So talking about the sweet part, how about the sour part? Anything that you are not happy about our program, just let me know. I can't do too much, but the dean is here.
Super happy. I love it. I think the sour part maybe sometimes when you're stepping into the new stage, like I have my first root canal treatment like in a recent month, and I'm super nervous of the previous day. I cannot sleep, and then I have shaky hands, but I think those are just some difficulty that every dental student has to meet up with, and also gain from those nervous moments. And now, because I have finished the post and core and finished the root canal treatment, then I think I gain much confidence for my next one.
Richard?
I think especially because we've entered our clinical years, it is very physically demanding. So we're probably in school by 8:30, and then we probably end school by 5:30, depending how fast you finish your treatments, maybe 5 or 6. I've had one time where I had to stay until like 6:30. But it is very physically demanding, and especially because so I play basketball outside as well. So to go through a whole day of clinic and then you go for training is very physically tolling, and it's also very it's tolling on your well-being as well and emotions, because you do have to persevere, and yeah, so that's kind of the sour bit of dentistry.
Okay, so we want our students to be really devoted to study dentistry. So unlike if you choose medicine, of course you can choose after you graduate what specialty you want to do. Like if you don't like to talk to any people, you can be a pathologist, right? You can cut cops. You can be a pathologist. You can be a radiologist. Any radiologists, parents here? No, hopefully no. So you can choose what you like. But if you choose to study dentistry, most of us will become dentists. And of course, you can choose to be a private dentist or a government dentist. You can choose to study a specialty and become a specialist. And you want to be a specialist, it takes 6 years, but you can do a master and decide whether you want to go further. It's not a must. Of course, we have other alumni, like we have singers, ever heard? We have some pilots, and they still do some dentistry. So it's really up to you to choose. But having said that, I think it's important that you know what you really like, because if you choose dentistry, you probably will be a dentist. So if you don't like it, if you find it, oh, it's gross to seeing someone's teeth is ugly, it's disgusting, don't pick us seriously. It's not just we picking you, it's you picking us as well, and that's more important. And if you like it, you love it. And even though all these sour parts, stressful parts as a student or even as a dentist, I still face it every day. I do a surgery, sometimes it's out of my control, breathing like crazy, spraying on my face. That I need to have the mentality to handle them, and only if I like it, I can handle it. And having said that, we do have dropouts, that 1 or 2 per year max. Per batch per year max, because they realize that they don't like it. So really explore your interests. I would recommend you, if you have any source, any connection, try to get a job shadowing experience. It will not add marks to your application, seriously, but you will know whether you like it. If you don't like it, don't apply to us, okay? And you can tell that the same kind of satisfaction and same kind of stress because they have to treat their patients, and that is a very important part of the learning. Maybe Tiffany, you share with us your normal daily routine, like not just about dentistry. What's your daily routine is like? I know you are in the entertainment business.
I'm not really in it, but normally, because now I normally have school from 8:30 to 6, So after having the school, and then I will just go back home to have dinner, and then after dinner I will do exercise for like 1 hour, and then just prepare for the case of tomorrow, and then just sleep. But normally for my entertainment in another industry, I seldom have any job opportunities, so it did not really interrupt with my dentistry studying experience. But like if I have any event that is coming up, then I will prepare all my case in a week before to occupy myself. So I think it's really okay to share and manage your time well in dentistry, so you can do anything you want besides dentistry as well.
Richard?
So I'm not in the entertainment industry, so I'm quite free. No. So what my daily routine looks like, so I go to school from 8:30 to 5:30. Then on Mondays and Thursdays, I have training with the HQU basketball team. But other than that, I also go to the gym by myself. And depending on how tired I am at night, then I go to sleep early. Then I wake up earlier the next morning to go to the gym. Then I head to clinic. It depends how I feel during the night. Um, the weekends, I like to kind of give myself some space to slow down, especially because Monday to Friday goes really fast now for me because I'm just in a clinic. I wake up, I eat, I sleep. So I like to slow down, go to the beach, read books, play guitar, whatever, hang out with my friends. I think that's very important as well for well-being, and spend time with my family as well. So good balance. Yeah.
Yeah, balance. Work-life balance is what we are aiming for dentistry. And I don't mind those candidates in the interview say, why do you want to study dentistry? Because I want work-life balance, or because it's rewarding financially. That is the truth, and they are being honest, and we don't mind. And in fact, we are very proud of the work-life balance part of being a dentist, because unlike in the medical field, like if you're working in A&E, or if you are a liver transplant surgeon, I know some of my friends who don't even dare to cross the harbor because they were waiting for a donor. Then it's stressful, it's rewarding, it's meaningful. But as a dentist, it's not life and death, but it's the patients are having very high demand aesthetically. So it's a different kind of stress. Having said that, you can always manage your time, like Tiffany, like Richard. They have very full schedule. You can manage your time as a dentist in your clinic. You can put all the patients in maybe 3-4 days, and then you have 2 days off. That's perfectly fine. Especially for girls who would like to spend more time with family, raising kids, you can spend maybe half time working and half time be a half-time mom. I think that's also very doable. There are many of these examples of my classmates having a very good balance of managing family and their career, and they are not totally out of the dentistry. They are still working, but they are also enjoying the time with family. And that's definitely possible to work as a dentist. And I think that's something we are very proud of. But at the same time, when we are working, you can tell that if you want to do more, you want to work more. It could be stressful, but it's at the same time, it is rewarding and satisfying. So having said that, are you living in Hall now?
I recently moved out of Hall.
Oh, okay. And you? Why?
I am living in Hull for year 1 and 2, and for year 3 because I think the clinic would be very stressful. So I just prevent from kind of managing my time. So I just quit the hall immediately when I step in year 3. But actually, a lot of my friends are still living in hall, and they found that actually it's still okay to manage both hall life and also dentistry life. Yeah.
So I lived in St. John's College from year 1 to year 4, and why I quit St. John's wasn't because clinic was too busy. One part was because I think I've had enough of hall life. I think it's good to change an environment. I think I was at the point where I was ready to step into a new chapter of my life. I've met wonderful friends from St. John's, but I am excited for change. I think change is good for growth. But also, I do find sometimes at night I have to tell the freshmen to keep it quiet because I am sleeping. So yeah.
How do you find the relations between the classmates and between the students and the teachers?
In PBDH. Oh, I think we have a great relationship with our teachers. There is definitely respect between both parties, But also then there is also an aspect of friendship. Like I am comfortable talking to my professors, to my tutors. I don't hesitate to ask any questions that I have. And the professors that we have and the tutors that we have are super willing to help us as well. So I love it. I love the environment.
For sure we'll have super nice and handsome professor, and then actually all of my
Examiner.
actually all of my tutors are super helpful. Like in clinic when we have something that we cannot really tackle well, and then they will just sit down and tell you how to do and help you to wrap up. And also, actually, the tutors are so good that they are even checking our homework in Saturday or Sunday and to correct our treatment plan. So they are really helpful and willing to help you at any time.
Yeah, I think we are very blessed to have many dentists coming back to teach. We have, of course, we have full-time staff who are teaching, but most of the teachers are actually very famous dentists in town. We have like 300 honorary and part-time staff that spend 1 or 2 sessions per week to teach our students. So we are teaching in small groups. So each of them will have a group of 9 or 10, supervised by 1 to 2 teachers, and they will be supervising them because dentistry is it's like apprenticeship. So you learn from the sifu, from the master. And these famous dentists, they want to give back to the school because we are training about 70-80% of the dentists in Hong Kong. They are our alumni. So they come back, they teach, they give back to the school. They also enjoy teaching, sharing their knowledge. So we both benefit each other. So that is something we are very proud of. And as you can tell that the teachers are very approachable. We are the smallest faculty, and anytime they can come to find us, we'll chat with them, and sometimes we have meal with them. We talk about non-academic stuff. We make friends. We play basketball together, not me, but we have teams that we even play fantasy football together. Imagine that. So that is something we are quite proud of because we are so small and we have a very close bonding. So that is something I think quite warm. Okay, going back to the admission. So can you remember, although it's some years ago, can you remember how do you apply and what are the criteria we're looking for?
So for non-JUPAS, I remember back in my year, our minimum requirement was 41 or 42 out of 45 for IB, 41 for IB. And so for non-JUPAS, well, for me personally, I also did do some shadowing experiences. I think I was able to include that in my personal statement. Yeah, so for non-JUPAS, we have to write a personal statement for HKU. And also for non-JUPAS, we have to put dentistry as our first choice. Otherwise, we will not be considered. So you have to choose what. So back then, I had to choose between medicine or dentistry. So obviously, I chose dentistry. And then chemistry is mandatory for higher levels if those taking IB. Other than that, I think that was...
Okay, it's like a dementia test. Tiffany, as a DSE student, what's your process?
I think there is some weighting in science subject.
Don't worry about it, and it changes all the time. So, but like, how can you remember? What's the process of picking dentistry? You knew you want to study dentistry, but can you remember?
I just put it in the first choice, and then I come for interview after JUPAS submission, and then they asked me about why I choose dentistry like today, and then yeah, I come here.
Okay, so we know Tiffany is going to apply to us, and we are so nervous. And when she pressed the button, oh, register, everyone's happy, and Joy's super happy. We have a mirror fan there. Hey, Tiffany, registered. But then, okay, some tips for JUPAS. For JUPAS, we are taking about 65% of JUPAS and plus CINDAS. CINDAS is the direct admission recommended by the principals. So about 65 to 35%. So for JUPAS, we only interview those who put it into Band A. But we only interview after the JUPAS result is released. So if you are confident, okay, I can get high marks because it's quite difficult to get in dentistry now. If you're confident that you can get the marks that it can be admitted to us, put a banner in the beginning. Otherwise, you just put it somewhere and you can change the ranking after the result is released. But we only interview those who are in Band A, okay? And if you are having a score that, like a reasonable score, we'll invite you to an interview. And only those who are interviewed will have the chance to study with us. Okay, so after all, JUPAS is mostly on academic result, not going to lie. But there's also, the interview will also look at whether you're really suitable, you like it or not. So because we interview some candidates, why do you want to study dentistry? Oh, because my mom forced me to come. Or even worse is, I don't want to tell you. Okay, fine, thank you very much. Wasted my 10 minutes in life, both 20 minutes in total. So really make sure you like it, and you can change your order after the result is released. For non-JUPAS, of course, the application, I think that it's opening on closed on 27th. Opening, doesn't matter. So we aim to have the interview around January to February. Okay, so if you want to study dentistry, put it into the first choice. Otherwise, we are not going to give you an interview. And the predictor score is important. I think for IB, you don't have to be a top scorer, but we hope you have as high as possible. We are looking at, I think for securing an interview, approximately 43, 44 for IB. 42 is a little bit risky. For A-levels, we hope to have all A-star. Okay, we hope. Try your best for the predictor score. But of course, you should be trying to put all your whatever into the application. For non-JUPAS, we're not just looking at the academic results. We have a bunch of excellent high scorers in DSE. So for non-JUPAS, we look at more all-rounded students as well. But the academic result is still the most objective way we can assess a student. So if you have whatever extracurricular activities, sports team, you are running a voluntary group, you want music, your diploma in oboe, whatsoever, just put it down. Don't be shy about it. And we look at everything together. And of course, your personal statement, you have to indicate that you really want to study dentistry. Like I've seen personal statements applying to us, having all the excellent CV, but say, actually, I want to study architecture. Sorry about it. We are not teaching you how to build we are teaching you how to build a tube, but not a building. So make sure all these are in place, and don't be shy about it. And oh, by the way, we have something new this coming year. Is that for the non-JUPAS and CINDAS, we will have something called multi-station assessment. It's a little bit like the MMI of medicine. So what is it about? I can't tell you because we haven't decided yet. But having said that, we want to look at not just the interview, but maybe some communication skills, maybe some hand-eye coordination, maybe some scenarios. We will think about it, but then we want to assess a student in all dimensions because we also asked to do so by the Dental Council. That's why. But for JUPAS, we are not implementing it this year yet. So that is something new that we are announcing it today. Okay? Any more things you want to share? Are the teachers good to you?
Very good.
Okay. That's what I want to know. Richard, anything you want to share?
I think we're good.
Yeah. Okay, thank you very much. Good to see you.